almost all beds in our local hospitals have been occupied non-stop since the start of the pandemic. The data shows pre-COVID, around 75% of beds were constantly in use. But since the pandemic, almost 95% of local beds have always been full. Julian Stanley is the Chief Executive of Healthwatch Cambridgeshire, which is the local independent patient watchdog. Julian, good morning.
Good morning, Dottie.
What's your reaction to these figures?
Well, it isn't unsurprising in a way. I do think that Jane made the great points really about the overall lack of investment in services, and particularly staffing problems are huge across Cambridgeshire and Peterborough. Not in the hospitals themselves per se, although there is a major staffing problem and there is a workforce plan to try and address that, but that's going to be a long-term approach. But it is also about social care, particularly adult social care, where there's a lack of places and beds available to discharge people to. So we've had recent closures of nursing homes and care homes in Cambridgeshire, and of course that has a knock-on effect because people who are ready to be discharged often don't have anywhere to be discharged to. So the beds are in a sense full a lot of the time because there's nowhere to send people. There's a new project that Cambridge is doing really well on virtual wards, which is a way of actually sending people home with a whole care package support and using modern technology to monitor people. And this works very well and is very popular with a lot of people who have the support at home able to manage that kind of process where they can go home sooner, if you like, because most patients don't want to be in hospital for long term. But you have got many patients who need care and need to be looked after when they're discharged, and that's part of the massive problem of bed shortages, if you like. And this comes back to a lack of investment, if you like, over the long term, over the past years, and is going to be a major political issue as we go forward about how the NHS is going to resource itself and how our hospitals are going to be resourced going forward.
Well, and also how social care is going to be resourced, I guess, Julian, given that, as you're saying, that is very much part of this picture. What impact does it have on the patient, Julian, if they're sitting in hospital, not medically needing to be there, but not having the support they need to go home?
Well, it's distressing because, as I say, most people don't want to be in hospital longer than they need to be. And then people also recognise they're taking beds in, but it's not their fault. Staff have to cope with that. And basically, there's a lot of frustration around because families look for places in care homes and so on, and residential and domiciliary care and so on, and home services. And these are very stretched. And part of that is to do with staffing because, as Jane was pointing out, sometimes retaining staff and staff who are tired, and also retaining and training staff. We have a massive shortage of all kinds of staff, nurses and doctors. So at all points there is pressure. And in terms of beds, there is a shortage, no doubt, of beds. That is what we're saying. We've also got issues around certain hospitals. Hinchingbrook will be rebuilt, for instance. A number of hospitals in East Anglia have now gone onto the list for rebuilding. And that's good news, but that's longer-term approaches. So there will be more capacity, but we've got a growing population across Cambridgeshire and Peterborough as well. We're one of the biggest areas of growth, if you like, of population. We've also got some of the biggest areas of deprivation around the country in parts of our county. So it's a complex issue. It needs a lot of cross-party political attention. That's, if you like, unlikely to happen in the run-up, I guess, to a general election, where, if you like, battle lines are probably going to be drawn. And at the moment, patients are having to cope with that, families are having to cope with that, and nurses and doctors, equally, who go to work to do a good job.
Julian, we're going to have to leave it there. Thank you for your time. The Chief Executive of Healthwatch Cambridgeshire, the voice of the patient in our county. That's Julian Stanley.